Okay, so you are working with NYC Smoke-Free. How has your work evolved over the years?
Sure. So we generally work on a number of initiative areas, ranging from reducing youth exposure to tobacco marketing. In New York City, we've actually had to shift that to looking at it more broadly and also from a health equity framework, more so looking at tobacco proliferation or tobacco density, if you will. And that's really focusing on how many tobacco retail outlets we have in, vulnerable neighborhoods where smoking rates tend to be much higher. So while smoking rates, yes, in New York City have gone down to 14%, which is awesome, there are a lot of pockets of populations and individuals who have not necessarily benefited from that. So disparities still exist. So we've kind of had to shift our messaging to reach those populations where they're more vulnerable, young people, seniors, and people who are in low SES areas. Another area that we've worked on and continue to work on is smoke-free housing. Again, shifting that from just the health message to a health equity framework, looking at that everyone deserves the right to breathe clean, smoke-free air in their homes, especially, not just folks who are fortunate enough to have, luxury condos or market rates, but also people who live in affordable housing or public housing. So we work with those individuals to raise awareness about the benefits of living smoke-free.
So what's on the horizon for NYC Smoke-Free?
So I think for us, we are continuing with that health equity framework, looking at things like menthol and their effects on certain populations. African Americans, women, and children smoke menthol cigarettes at higher rates. The smoking rate in New York City is 14%, and out of smokers, over 85% of African American smokers smoke menthol cigarettes. So that's something that we're actually looking at into broadening our area of tobacco disparities and trying to close that gap.
It's quite interesting. So